Welcome to this week's Health and Care update about the coronavirus pandemic in Devon. While rates have been falling, we're now starting to see a decrease in the level of those rates falling and start to stabilise. And we're also still seeing some outbreaks in workplaces and care homes. I'd like to hand over now to Maria Maloney-Lucy, who will give you an update on the data in Devon.
This is an overview of the latest national and local data on COVID-19 as of Thursday, the 18th of March. We start with the national picture. Cases continue to fall nationally, but are still above the levels seen last summer and early autumn. The number of tests continue to increase and deaths continue to fall. Now for the local picture. In Devon, for the latest available week, there were 172 COVID-19 cases and 7 deaths, with rates of both below the national average. Case rates are slightly higher in eastern Devon. Cases of COVID-19 are continuing to fall in Devon, although the rate of decrease has slowed over recent weeks. Case rates are currently highest in those aged 20 to 39 years. Data in this summary is drawn from Devon's COVID-19 dashboard and the National Coronavirus Tracker, where the latest available information can be found.
Thanks, Maria. Over the last week or two, we have seen a couple of large outbreaks in care homes in Devon, with both staff and residents becoming ill, some seriously ill, and unfortunately, there have been a small number of deaths as well. This in a population where most of them have been vaccinated. So it's obvious we're going to get questions about how effective the vaccination is and why doesn't the vaccination stop all serious illness and deaths. The vaccination has been incredibly successful. We've seen the number of hospitalisation and deaths reduce significantly. The latest data coming out shows that having the vaccination offers protection from getting COVID-19 by about 60%. It protects you from hospitalisation by about 80% and protection from dying from about 85%. But no vaccine's 100% effective. So there will still be people who catch coronavirus, and particularly those most vulnerable, the elderly, those who have clinical risk, who will potentially get the coronavirus and still become seriously ill. So it's still really important that even when you've been vaccinated, that we continue to adopt public health measures, social distancing, wearing face coverings, and washing our hands regularly. So we are going to continue to get small outbreaks in settings, care homes, workplaces, for example, schools, and whenever we get an outbreak, the response is quick and swift. The agencies come together, we look at how we can put in additional resources, whether that's staffing resources, we increase deep cleaning, for example. These measures are designed to protect and safeguard those people in that setting and to try and reduce any onward transmission. As I said, we can't take our foot off the pedal, and even when people's been vaccinated, we still have to follow those public health measures. Stay at home. If we do need to go out, make sure you keep your social distancing, wear those face coverings when you're indoors in public spaces, and wash your hands regularly. I'd now like to hand over to Dr. Paul Johnson, NHS Devon CCG.
The number of coronavirus cases and patients in hospital with the virus has stabilised over the past week, which highlights the need for us to continue to be careful. The roadmap out of lockdown is extremely positive, but we still have those regular reminders that COVID is a risk for the most vulnerable in our communities. So please do continue to be careful and follow the guidance. More than 500,000 people in Devon have now received a first dose of the vaccine, which is a remarkable achievement in just 14 weeks, and thanks to the dedication of staff and volunteers across the county. Half our adult population, 95% of over 65s, and a quarter of people aged 16 to 64 have now had their first vaccination since Kathleen Viney became one of the first people in Devon to have the vaccine on the 8th of December. And this week, people aged 50 to 54 in cohort 9 began to be invited for their vaccine, which may now come via a text message from the national booking system as NHS vaccine, followed by a letter a few days later. You can also continue to book through the National Booking Service website or by phoning 119 if you're in one of the eligible groups. Text from NHS Vaccine will enable you to book an appointment at the larger vaccination sites or community pharmacies, and are separate to any invites you may get from local NHS services such as GP surgeries or hospitals. There have been reports of fraudulent texts and emails, so make sure you are careful. Remember, the COVID-19 vaccine is free, and the NHS will never ask for bank account or card details, for PIN or banking passwords, or copies of personal documents to prove people's identity, such as a passport or driving licence or bills or pay slips. If you think you might have been a victim of fraud or identity theft, report it to Action Fraud on 0300 123 2040. There are concerns about blood clots. The UK Medicines Regulator have reviewed the evidence. The number reported is no greater than would have occurred naturally in people, regardless of whether they have received the vaccine. So I want to reassure you that the coronavirus vaccine is safe. With that in mind, I encourage you to get your COVID-19 vaccine when invited to do so. Reaching 500,000 vaccinations is a fantastic achievement and a huge credit to staff and volunteers right across Devon. However, there is still a long way to go before we will have offered everyone in the county a vaccine. So please continue to follow the national guidance, stay at home as much as possible, and get your vaccine when you're invited.